Adolescent by Peterson and Kayleen. This is a case study summary. Sean is an adolescent 13-year-old white male. Sean has a younger brother who is 10 years old and a younger sister who is 7 years old. His mother and his father were married for 9 years before separating due to physical and verbal abuse. Ever since Sean could remember, his father always drank excessively. When his father drank, he became extremely belligerent and violent towards his mother. Sean's mother was hospitalized 3 times after his father physically attacked his mother, which led to her being admitted for injuries ranging from a broken nose, bruised ribs, and concussion. At the age of 8 years old, Sean attempted to intervene after witnessing his mother being shoved to the ground. Sean was violently pushed against the living room floor and fractured his wrist. In addition, Sean sustained constant verbal abuse and was called good-for-nothing, knucklehead, stupid, little bum, and other vulgarities. When Sean was 10 years old, his father left home and never came back. Sean has not seen nor heard from his father since. Sean's mother has been called to the school several times because Sean was heard verbally abusing his classmates. He is using words that are inappropriate and was caught punching another student because he would not give Sean a pencil. After numerous meetings with school staff, teachers, and counselors, Sean's mother decided that sports might help Sean channel his bad behavior. Sean was involved in a fight during a basketball game and punched a kid from the opposing team on the nose. Sean had to be removed from the team because apparently Sean was also hitting some of his classmates and teammates for not passing him the basketball during practices. Sean was subsequently arrested at the age of 13 years old after joining another basketball team and punching another kid, breaking the kid's nose, and uncontrollably aggressing towards other kids. Sean was given a court date, and the judge mandated that Sean see a social worker once a week for a minimum of 6 months. After meeting with Sean, the social worker assessment of Sean discovered that he had serious behavioral issues and was projecting anger due to past abuse. The social worker produced a genogram to better understand the family dynamics and to get a better sense of Sean's home environment. Here are the theories and practice recommendations. 1. Insight-oriented and individual treatment seeks to increase the ego's capacity to tolerate emotionally conflictual situations that are partially or completely repressed. These situations commonly happen in early childhood and affect the client later on in life when a similar situation or event happens. Supportive individual therapy involves a review of examination of the client's stress situation and offering advice and clarification to assist in judgment and clear assessment of stressors. Like insight individual therapy, supportive individual tries to improve the function of the ego. Cognitive behavioral therapy is about cognition, emotion, and behavior. The purpose of this type of therapy is for the client to recognize when the interoperate situations in a negative manner and modify these negative interpretations and negative behaviors to relieve stress. These practice recommendations will help Sean gain the skills to handle difficult emotional situations, identify his stressors, and change his thinking patterns. It is recommended that the entire family be present in some of this therapy as well. This will make sure Sean is accountable for his homework in therapy and may also help the family become more successful.